Good morning, everybody. This is Chris Marchand, and we have a special presentation for you today. We've been coordinating this for quite a while, so we're really happy to be able to bring it to you. I wanted to introduce Debbie from the state, let her do a quick introduction, and she'll introduce our guest speaker today. Debbie, can you join us there?
Hi. Hello. Can you hear me?
Yes.
Okay, great. My name is Debbie Kauchek. I'm from Division of Public and Behavioral Health. I'm the Tobacco Cessation Coordinator. And Allison Winter from National Jewish Health, our vendor for the Nevada State Quit Line, will be presenting today.
Great, and if I can just jump in for a second, I just want to sort of talk about or give you my sense of the magnitude of this issue. You know, this is our endocrine and diabetes clinic, so you might say, well, why are we talking about smoking cessation? Well, smoking cessation is an appropriate topic no matter what the forum, but in talking about smoking and in people with diabetes, you know, you can't overstress the magnitude of the issue. Smoking is an accelerant, if you will, use an analogy with wildfires. It sets free the pathology of diabetes and its impact on the vasculature. So it's a lethal combination. Despite all the things that smoking does to people in general, what it does to folks with diabetes is a whole order of magnitude different. And I think that when we have patients with diabetes who are smokers, the importance of an intervention for smoking cessation is probably the single most important thing we can do. Controlling blood sugars in a smoker is tantamount to rearranging the Titanic deck chairs, right? This is a critically important issue, and I'm so delighted that we can address this in ECHO clinic this morning. So I'm really excited about this, and I can't overstress the importance of this issue. So I thank everybody who's helped us put this together, and I just have been looking forward to this. So thanks very much. Alan, you're on.
Perfect. Good morning. Just waiting for our slides to pop up.
Yep, Troy's got those for you in just a second here. Can you see me now, Allie?
Perfect. Thank you very much. Once again, my name is Allie Winter. I am speaking on behalf of National Jewish Health Hospital. I have the privilege to work with the Nevada Department of Health and Human Services, and we, in conjunction, put on the Nevada Tobacco Quit Line. So thank you for having me here to present today. We always love having the opportunity to educate about the Quit Line, especially to healthcare providers, because smoking is such a high contributor to chronic diseases, as you all know. And just to echo, if people with diabetes who use tobacco really are at such a higher risk for serious health conditions. Today, I'm going to do a very quick overview of National Jewish Health, and then kind of talk about specifically the impact we see in Nevada from smokers, and then I'll describe the Nevada Tobacco Quit Line and how you guys can all refer to us as healthcare providers. And at the very end, if you have any questions, we'll open it up for some Q&A, and hopefully I'll be able to address any items that you have.
This one is the volume? Yeah, this one should be.
Having a little trouble. Advancing, hold on one second, having a little trouble advancing the slides.
How about now?
There we go. Perfect. So a little bit about National Jewish Health Hospital. In 1899, we began as a refuge for tuberculosis patients. Tuberculosis, as you all know, is a bacterial disease that mainly affects the lungs. Back during that time, it was believed that the sun was actually a cure for the disease, which is why Colorado became a home for the treatment. Here in Colorado, we get over 300 days of sun, so it was believed that these patients could come to Colorado and it would alleviate their symptoms. The image you're seeing is actually, they're called sunbeds. Our nurses used to wheel out these patients into the sun and they would just lay there throughout the day, and it was believed that that's actually a treatment for tuberculosis. So that's how we all got started back in 1892, and since that time, we have been ranked the top respiratory hospital in America. That's since 1988, and our focus today is on preventative personalized medicine. We created, because we are a respiratory hospital, we wanted to help essentially alleviate the issues that we were seeing at our actual hospital, and a lot of those were being caused by smokers. So we created our tobacco wellness program back in 2002, and that focuses on the #1 cause of preventable death today, which is tobacco use. So a little bit more of us as an organization. We are actually a nonprofit. We are the largest nonprofit provider of tobacco cessation in the United States. Our services are clinically and medically oriented, and we build on that expertise as the leading respiratory center for the last 118 years. Our faculty and staff advance prevention and treatment of chronic disease through our published research, and we will collaborate with other nonprofits and organizations, and we do that to obtain funding so we can create some customized cessation programs. Hopefully I can touch a little bit on our specialized programs for pregnant women, as well as American Indians, which we have started and published here at National Jewish. And we like to say that we actually save lives twice here at our institution, because every dollar that we earn from the quit line is reinvested back into our hospital. So hopefully we can help people quit smoking here and then actually go help cure the diseases that we're seeing as a result of the smoking. So here's a map that kind of shows all of our state quit line partners here at National Jewish. We have a national network of state quit lines. There is a quit line that exists in all 50 states, the District of Columbia, Puerto Rico, and even Guam. We are all part of a national portal called 1-800-QUIT-NOW, which I'm sure you guys are familiar with, or I hope you're familiar with, and it connects callers with their state quit lines. Quit lines have received over 1 million callers and have helped nearly 500,000 tobacco users quit smoking in just the last fiscal year alone. So it does show the success that we have with quit lines. We have been working with the Nevada Tobacco Quit Line since 2014, and we love our partnership with Nevada. One thing that's kind of special about National Jewish is we really can create customizable programs. So we look at what's actually going on in the state of Nevada and hopefully can create a program that's really customized for the needs that you guys are seeing as providers or what the state's seeing in regards to funding. So we can really create the best possible program for everybody at National Jewish. Quit lines are a telephone-based cessation service, and we can help people quit smoking through a variety of services. This includes counseling, FDA-approved medications, and we can also send self-help materials. Just to look at the magnitude that we're talking about of the toll of tobacco in Nevada, I'm not going to go into all of these specifically, but I want to just throw some numbers up there just so you could see the magnitude that we're kind of looking at here. These are the deaths in Nevada from smoking alone. As you know, smoking kills more people than alcohol, AIDS, car accidents, drugs. So it really is kind of a huge issue, and sometimes it gets overlooked just as it's been kind of a long-standing issue. And when you're looking at from the state perspective, you can see the monetary cost of what, oh, it's really going fast. Sorry about this. There we go. So here are some of the costs that you will see in Nevada specifically. These don't even include the health costs such as secondhand smoke, fire, smokeless tobacco, cigars, or pipes. These are all just numbers from just smoking alone. So you can see kind of the magnitude that we're talking about when we're looking at smoking as an issue in Nevada specifically. So I want to go over our services at the Nevada Tobacco Quit Line. So when you're actually referring patients to the Quit Line, you know what your patients are going to get, what services they will be receiving, just so you have a little bit more education on when speaking to them about tobacco. So participants can enroll through a variety of ways into our Quit Line program. The most popular is by calling 1-800-QUIT-NOW. As I mentioned, there are telephonic cessation in every single state. So we actually have an agreement with all state providers to send participants to the right state. So if somebody in Nevada calls from a different area code, we can actually still serve them and transfer them without having any issues. The telephonic counseling is then offered to the participant as soon as they call 1-800-QUIT-NOW. You can also do fax referrals from their healthcare providers. That's going to be probably the second most popular way for participants to enroll in the program. And then we actually have a new updated website here at National Jewish, and this is for the Nevada QuitLogics program. So we use this with the state of Nevada, and participants can actually log on and enroll straight through the website. They do kind of an abbreviated intake and can enroll pretty quickly that way. Some of our states allow NRT to even be ordered directly through the website, so it is very easy, and our clinical director actually helped create it. So they can develop an online portal, they can get assistance through the web. It's been a really big success so far. We also provide local resources listed on our website as well. For example, worked with Debbie a little bit earlier this morning, and we actually just added in some additional diabetes resources onto our webpage. So if a participant calls in and they mention they have diabetes, they can be referenced to additional materials that are Nevada state specific. The Quit Line program is open Monday through Sunday, and those are the hours, and we can serve all languages. We have a translator, and we also have a good number of bilingual staff here, so the participants can always be helped on at any time. Okay, so our standard clinical model is a 5-call program, and that is actually what Nevada uses. So a participant can get referred into the program and have up to 5 coaching calls. So we have both intake representatives here at the Quit Line and then coaches. So our coaches are trained in order to help the participants be met at their stage of change in tobacco cessation. So all of our coaches have lots of training. They all have their bachelor's degree, and they're always going through continuing education in regards to smoking cessation. So a participant will get up to 5 coaching calls with our designated coaches. Even after they have their 5 coaching calls, they can always call back into the Quit Line for additional support. We know that quitting is difficult. You know, it takes more than one attempt. So a lot of times they can call back in if they're having a triggering situation, even after they're maybe have moved on from the program. We offer text messaging, and about 66% of Nevada participants have opted into the text messaging program. Some of the great things about the text messaging program is you get reminders of when you have a coaching call appointment. You can get status updates of when your NRT has been shipped, which is nicotine replacement therapy. You can get kind of motivational messages, and we've found that there is an increased percentage of people who quit who opt into that program. We also offer an email program, which is similar to the text message program. It's just in the email form. And then we offer customized Quit Line materials. These are personalized and sent via the mail or email. Over to the right, that's kind of a quick little snapshot of what our materials look like. The bottom flyer, we actually do have a diabetes specific flyer as well, and it kind of outlines some nice stats on how people with diabetes who use tobacco are likely to suffer from serious health issues. So just to explain a little bit how they would receive that is if during their intake or their first coaching call, they note in their medical screening that they have diabetes, this will come in their mailed packet. So they'll always have like customized materials based on how they answer their intake or when they're speaking with their coaches. And we can always send the additional materials for additional support as well. Some of our specialty programs here at the Quitline are our pregnancy and postpartum program. We offer incentives to the women who participate in this program. They receive an incentive, I think it's a $5 per call when they're pregnant and $10 postpartum. And the reason we do that is we see a really high number of women who quit smoking immediately when they're pregnant because they want to do it for their baby. But when they move into postpartum, we actually see a huge decline of women wanting to enroll in the program. And a lot of that is just due to wanting to quit for the baby and not necessarily quit for themselves. We really focus here that it's for the well-being of both parties. So we really focus a lot on our postpartum program as well. And we have our American Indian program. That program is just a couple years old. It was a pilot program that was launched here at National Jewish. We have actual American Indian coaches that assist those participants specifically in that program, and it has been a huge success. So that's also a program that we can offer here at the Quitline. Nicotine replacement therapy, as you guys can all assume, is a huge part of our program. A lot of callers are prompted into calling the Quitline because of the free nicotine replacement therapy. The state is able to offer NRT currently to the uninsured and pregnancy and AI programs. So it's not to all callers, but a lot of times our coaches can assist. We lost it. A lot of times our coaches can assist participants in being directed to their medical care provider, as there are a lot of resources available for nicotine replacement therapy for them as well. And I'm not sure where. Sorry about that. We'll see where that, not sure where that went.
Yeah, sorry about that, Allie. You should have control again now.
Okay, thank you. Sorry, I'm not sure where that was.
That was.
There you go.
Okay, so the products that we can offer at the Quitline are patch, gum, and lozenges. All of our participants go through a medical screening. So as healthcare providers, you might be required to send a consent for nicotine replacement therapy if a participant is ineligible. That means if they opt into having certain health conditions in the medical screening, we will not just send the nicotine replacement therapy unless we get a consent from their provider. So we will send the consent form to them directly if they, mention that they have one of the health conditions that kind of puts a red flag in us sending the therapy. And then you guys would probably see it on your end and have to sign it in order for us to send them their NRT. We have the ability to use combo therapy, which means they can do patches and gum or lozenge at the same time, and that's actually where we see our highest quit rates. The NRT is shipped directly to the participant's home, and it's at no cost, and they do have to be enrolled in coaching. That is also where we see our highest success rates, is when somebody uses NRT in conjunction with the coaching. Okay, so these are kind of talking about the magnitude of our call volumes that we see at National Jewish. We can see between 12,000 to 27,000 calls per month across all of our clients. Nevada specifically sees a huge volume change during the CDC's annual TIPS campaign, which I'll go into here in a second. They will actually see almost double or triple the volume from Nevada specifically during this campaign, which is huge. We also process about 5,000 provider referrals each month. About 25% of all provider referrals result in an intake or enrollment. One way that you guys can help us increase that number is just by talking to your patients about tobacco. We see our lowest, as you can assume, enrollments when a participant is unaware that a referral was sent into the quit line, which does actually happen. If they're unaware that that was actually sent in, we see a much lower rate of them actually enrolling into the program. And across all of our clients, we convert approximately 84% of intakes into coaching. This is kind of showing the volume changes that we can see based on the CDC TIPS campaign. In March of 2012, the CDC implemented the TIPS campaign. It was made possible as a result of the investments from the Prevention and Public Health Fund. TIPS was the first part of a national tobacco education media campaign that provided real, living, serious long-term health effects for smoking and secondhand smoke exposure. So the campaign ads are made to educate smokers about the importance of quitting and encourages them to call the quit line for assistance. So that TIPS campaign has been huge in reaching people, not just in Nevada, but across the whole country, and educating them about the serious health risks of tobacco. So here's the important part about how you guys can help us, and it's the different ways that you can actually refer to the quit line. So there are 3 big ways that you can refer to the quit line as healthcare providers. And this is actually located on our website as well. So if you ever want to have a little bit more detail on each way that you can refer, we have all of the resources on our website. So provider web referrals. So when you go to the Nevada Tobacco Quit Line website, there are provider web referrals available. We see about 5% of all referrals are through the web. The reason we actually love these types of referrals is, as you can imagine, there's not any room for error. There's no illegible handwriting, there's no spelling errors, there's no address errors. It's immediately put in correctly through the web and it gets sent directly to us. E-referrals are electronic referrals. It's essentially where you can use somebody's health record and send a referral directly through a HISP to the quit line. We don't currently have any of those up and running in Nevada, so I'm not going to spend too much time on them, but I do think that's kind of the direction that we are moving in the future. We continue to see a lot of healthcare providers in hospitals and clinics moving towards using e-referrals. And then fax referrals, that's still where we see the vast majority of all of our referrals, and those are just through the standard fax, which we'll go through in a second. In Nevada, we see about 50 referrals from providers each month, but we're always looking to increase that number. So here is the standard fax form. So you can get this on the website, or the Department of Health can always provide it to you. We encourage, as much information as you can provide, but we typically minimally just need at least the phone number and the patient's information. That's so we can get in touch with them. So as I mentioned, 85% of referrals are through these fax forms, and they go directly to us here at the Quit Line, and we'll implement them into our case management system and then call out to the participant. You'll receive status updates via faxbox. So we'll let you know, as long as you're a HIPAA-covered entity, if a participant is enrolled, when they order NRT, if they become disenrolled. We'll send different status updates back via fax. And here are the provider web referrals. Here is a screenshot of our homepage for the Nevada Wellness Tobacco Quit Line. So at the very top, you'll see you can be a healthcare provider. If you click on that link, you'll be prompted to do a provider web referral, which kind of looks like a fax form. One of the other benefits of doing this through the web is we have implemented cookies onto that web page. So once you complete the form once, it'll remember your clinic or your clinic's name and information, so you won't have to continually fill that out. So you'll only have to fill out the information on the patient. So it is actually a lot easier for you as a healthcare provider as well. We will still send status updates via faxbox. So as long as you're a HIPAA-covered entity, we will send you those same status updates on your patient. And we are still seeing about 5% of referrals through this, but we definitely encourage people to do this more often. We even have the capabilities of letting you know you know, how a participant's doing through the program. We have additional provider resources on our website, and this is kind of a screenshot of how the healthcare provider portion looks like. We can give you more details about how the program works. I know today is such a quick snapshot, but this can give you a little bit more information. Frequently asked questions. We even have a video from our clinical director about how she suggests you can talk to patients about tobacco. And then we have all of this information on how you can refer to the quit line, just for your reference again. It's always fun to see some outcomes reports of how successful this program is. So this is going to be Nevada specific. So here are the retention rates of quit line participants, and it corresponds to their quit rates. So this is just showing that the longer a participant is engaged in our program, the higher their quit rate. So that's why quit lines really are, you know, backed by a lot of data. I like to say we love data over here. The CDC, it's a proven method to have people quit tobacco. And so as you can see, the longer a participant is in the program, so call 5+, you're going to see a huge quit rate of almost 50%. That's a huge quit rate. So we do encourage you guys to, you know, encourage our patients to stay in the program, participate in the program, because we do see success in the program. And here is another quick little graph. This is a 6-month quit rate. So essentially when a participant calls in or a patient calls in, we get their consent to be contacted 6 months after for a quick survey, and essentially that just to see if they are still quit. And typically the national average for quit lines averages between 20 to 30-ish% of people who stay quit at 6 months. And you can see that Nevada, you guys are at almost 27%, which is definitely within the average, which is great. That means 30% of people that are going into this program who do an intake are still quit 6 months later, which is really great. We like to see that. So now I just want to open this up and see if anyone has any questions. I'm happy to answer anything if in regards to referring to the quit line, any programmatic questions. Just let me know.
So I'd love to see a show of hands for people who might have used the quit line for their patients before, but we have so many people who are not on video that a show of hands isn't really going to work. So I'm not sure what other polling tool we can do, but I'll just ask the group, because we have a pretty big group this morning, has anyone referred a patient to the quit line and had an experience that they wanted to share? Okay.
I do have everyone on mute, so if you do have something to share, please unmute yourself with the icon in the lower left corner of your screen, or if you're joined by phone, it is *6.
Allie, is there printed material that providers can have in their office to distribute to patients at the time of a visit?
That's a great question. We can absolutely provide materials. We typically don't like to mass produce our quit line materials, which is our standard My Quit Journey booklet and all of those inserts, because a lot of times we like to incentivize people to actually use the materials with the program. But if you want to have like 1 or 2 copies on hand that helps a provider speak to a patient, we can definitely provide those, and you can either request that through us or you can request it through the department.
Okay.
And
the other thing that works for us sometimes, or works for me in clinic, is to have a wall poster, because it may, you know, trigger the patient, but it also triggers me as a clinician to say, oh yeah, we have this resource. You know, sometimes that can be helpful, and I'm wondering if that might be available.
Absolutely. I will touch base with Debbie. Typically, the state is the one that creates all of their marketing materials.
Okay.
So they definitely have those type of items offhand, and they can easily send it to each clinic that needs it.
Yeah, I think that would be incredibly helpful.
We do have
Absolutely.
we do have some digital materials that Debbie shared with us that we'll post as a resource on our website as well.
Sure. Yeah, that'll be terrific.
And we have a comment in the chat here from Christina Floyd that they have referred people to the quit line, and using the form doing direct referral seems more effective.
Very good. That's helpful.
Question?
Yes, Dr. Van Gilder.
Hi. So this is pretty well advertised in some places. Can patients self-refer through that 1-800-QUIT-NOW, or do they have to have a referral from a provider?
That's a great question. They can absolutely self-referral. They can hear about an ad from 1-800-QUIT-NOW on TV or see a billboard and be prompted to call in. That's actually our highest number of referrals or self-referrals. If they opt into certain medical conditions in the health screening portion that we can't provide them their NRT, that's when they might get referred back to a provider, but we can definitely move forward with the program without any provider consent.
Okay, because I've referred people to that number, but I didn't really know there was a form, so that's good for me to know.
Yeah, and you're welcome to use the form. That's kind of one way that it removes the patient from having to call in. Sometimes we found that maybe they might be in a doctor's office and say that they're ready to quit, but maybe they're not ready to quit. And as soon as they leave, they're not actually going to call the number. But sometimes if we call them and follow up, we'll follow up 3 times after you guys send in a referral. We're not going to, if somebody's not going to answer after 3 times, we know they're probably not ready, but we will do 3 attempts, which can give you some peace of mind that they really are being contacted.
Great. Thank you.
And there's another question here. Did you say that Nevada could not refer through the web?
Nope, they can refer through the web.
Okay.
I think the distinction was that we don't have information exchange that functions to connect through our electronic medical records directly. Is that?
Yes, you're correct. Thank you for clarifying that. We have not set up any of our electronic medical systems, record systems, so e-referrals we call them. We haven't had any of those set up in the state of Nevada yet, though we are working on it. So hopefully in the near future, but those are fairly timely and actually pretty expensive. So it's been kind of a larger initiative that we've been working through. So hopefully in the near future, we'll have more of those set up.
Great.
And are the numbers you reported, the 45%, is that with NRT or without NRT?
That could be either or. That number was a massive number of everyone that went through the quit line, but we didn't provide all of our outcomes report. That outcomes report is actually pretty thick that we provide the state, but we do see highest numbers with coaching and NRT. The most effective NRT is through combination therapy. So when you do 4 weeks of patches with 2 weeks of gum, because then they can have the patch 100% of the time and then use the gum when they're going through like a triggering situation. But we definitely see the highest quit rates with combination therapy and coaching.
I have another question. Allie, how long does it take someone to complete the full course of the program? Because it looked from the graph that it looked like your completion rate was about 20%. And maybe I may have misread that, but it looked like about...
No, definitely, you didn't misread that at all. It's definitely a customized program, so it depends on the individual. So nobody really follows our clinical model, but if it was our clinical model, they would be about 2 weeks apart every coaching call. But if a participant's having a triggering situation, they maybe want to have their coaching calls further apart, they definitely can do that. We typically quote that the program, if it's fully completed, can be done between 3 to 5 months. And that's just after they complete the intake and have each coaching call and they are receiving their NRT through standard shipments. It's typically 3 to 5 months. But as you can see, not every participant, when you look at the retention rate, is completing over 5 calls, 5+ calls. It's actually more rare somebody to actually finish the full program.
Yeah.
You typically see participants finish the full program when they're enrolled through their employer, and it might be incentivized, or they might be getting an employer's tax by being, a smoker. So that's typically when you see people finish the full program. But when you're going through the state program, we typically see that number a little bit lower. So I think 20% is pretty average for doing the entire program.
Still, listen, if we could impact 20%, we're rocking, I think. That's a huge public health win, and essentially at no cost to the individual and no skin off the back of the clinician. This is what an amazing opportunity. So are there any other questions for Ali or Debbie? Seeing none, I will thank you both so much for participating, and we'll move on to a case that was submitted.
Thank you very much for having us.
Oh, thank you. Can't thank you enough.